We are back on Taking Care of Business on Koerner Radio, News Talk, 1180, 1230, KGEO, 1410, KERI, now in Albuquerque, New Mexico on 1000 KKIM, and now 3 times on the Internet on knookmedia.com, serving Richmond, Oakland, and the San Francisco Bay Area, which happens to be where our next guest is from. Yeah. So what do you think of... Elon Carr?
I wish him luck.
Yeah, I mean, that's going to be a tough district, but I would love to see him take that district. That would be great.
Well, based on what's happening with Obamacare, there's going to be a lot of new legislators in Washington.
Yes, and always one of our favorite guests, one of the most, if not the most knowledgeable person on Obamacare in the country, is our guest right now, Sally Pipes, president of the Pacific Research Institute. Sally, welcome back to Taking Care of Business.
Well, thank you for having me back on.
It's always
great.
A pleasure.
Well, we like to talk about Obamacare with you because you are so knowledgeable. And we just heard that over 7 million people enrolled in Obamacare.
Well, now keep in mind, this is from the woman who said, if you want to know what's in the bill, we got to pass it.
Right.
So.
Yes, exactly. Nancy Pelosi, 11 days before March 23rd, 2010. We have to pass this bill so that we can find out what's in it. And, of course, on March 23rd, Obamacare celebrated its 4th anniversary. And then on Monday, March 31st, was the deadline for people to enroll in the exchanges, either healthcare.gov, the federal exchange, which 36 states have signed on, and I'm sure that was a major eye-opener for the president and the administration. I think they thought every state would rush to set up their own exchange. And then we have 14 state-based exchanges and the District of Columbia. I really felt that there was no way they could reach that 7 million number by March 31st. And, I mean, I'm very interested to find out what is the makeup of those 7.1 million people. And I'm sure you are, too.
Oh, well, I'll tell you how they got it, Sally. It's pretty apparent to me. Nancy Pelosi, this was reported in the L.A. Times, and, the L.A. Times is fairly close to Disneyland. So I'm thinking that's probably where they got the $7 million or 7 million person figure was Disneyland. It's kind of made up.
Right. Well, I mean, there are a number of things that are very important to think about when you think about the 7 million, because it is being reported by in the estimates that between 15 and 20% of the people who have signed up have not paid the premium. So it's going to be interesting. What does that mean? Will these people ever pay the premium? I don't think so. The other thing is, what is the age distribution of those 7 million people? Because what we've been seeing is that the young invincibles, the people between 18 and 34, only about 25% of the people in that age bracket have signed up, and the age bracket 35 and over, 69%. So if you have fewer young people signing up, they are the people that are healthy, and you have many more older and sicker people who are going to put demands on insurance companies for claims. This is going to cause an implosion of the law. And the second point is that the Obama administration spent millions of dollars of our taxpayer money promoting signing up for Obamacare. They use stars like Eva Longoria, NBA stars, current stars like LeBron James and Kobe Bryant. I mean, they really really put out all the effort with our money to promote this. So, but I think it's really going to be interesting. What is the age distribution? Are those people who signed up, are they actually going to pay for the premium? There's all kinds of things that are very important for us to find out. And the administration has not revealed these statistics to us.
How many of these people actually had insurance before and lost their policy, and now are coming on and they're going through the exchanges because they get a subsidy? So,
right. I mean, that's important, too. I mean, well, McKinsey in their latest study, and RAND as well, showed that only 27% of the enrollees were previously uninsured. So it means the rest of them had individual insurance, or they were with a company where they had their company-based insurance, and now they've gone into one of the exchanges.
Have we really impacted the uninsured, which was the initial goal of this whole program?
Right. The president had two main goals. One was universal coverage. The other was bending the cost curve down. And if you only have 27% of the enrollees so far being people who are previously uninsured, no. And the Congressional Budget Office came out about a month ago saying that by 2023 there will still be 31 million Americans who are uninsured. So they're not reaching the people that the president told us his two main goals are not going to be reached under Obamacare. I think it is so important for the people on our side because 55% of Americans are still opposed to this law. That the Republicans have to get together. They have to have one single replacement plan, and they've got to go with it. Every day you see Eric Cantor says, well, I'm going to be having a new plan. Paul Ryan's going to have a new plan today. Bobby Jindal said he's going to have a plan. The Republicans need to get together and not act like cats in a laundry bag. They need to get together and have one replacement plan so that the American people can figure out, what it is that is going to replace this law. And as you know, a lot of the people that had signed up, many of them are very distressed to find that the doctors that they previously had, the hospital network that they were previously in, are not covered under the network of their new exchange plan. So, and then on top of it, their premiums are more expensive, and the deductibles are higher.
Yeah, definitely. We're having a conversation with Sally Pipes, president of the Pacific Research Institute and the author of 3 great books on Obamacare. You just did a segue for me. Coburn, Senator Tom Coburn, was, I guess he was talking to the Washington Examiner, and he is a doctor and a former cancer patient himself. And this was earlier this week. And he had mentioned that 19 of the major cancer centers in this country, only 5 of them will be covered by Obamacare. That's a disaster looking for a place to happen. So we're going to cut down the facilities that can take care of something as major as cancer from 19 to 5. Right,
exactly. And, when the president was lobbying for his Patient Protection and Affordable Care Act, which is a double oxymoron, he kept saying, that the integrated systems, the Cleveland clinics, the Mayo Clinic, the Intermountain Health, Geisinger, these were his models. Well, it's so interesting that now Cleveland Clinic, Mayo, these people, many of these top cancer facilities are not available to people who have purchased their coverage on the exchange. And we've seen, even in Los Angeles, it's not, that cancer is one of the issues they deal with, but Cedars-Sinai is not accepting coverage for anyone enrolled in the exchange under Covered California. And so that's a really important point, that for not just for not having access to your doctor, not having access to your hospital, but if you have a serious disease such as a form of cancer, you want to be able to get the best treatment. And people are, as Tom Coburn pointed out, going to be shocked that most of the many of the top cancer facilities are not going to be available to them. So the president's statement, if you like your health plan, you can keep it. This is just proved to be a complete lie by the president and by the administration.
Well, if you like your doctor, you could keep him.
Right. And Senator Coburn not only is a cancer survivor, he currently has new bouts of cancer, and unfortunately he's not going to run as of now for re-election in 2016. He's an important member of the U.S. Senate and really understands the health care situation. So I'm disappointed, but we've got a lot of new young people that are going to be running in the Senate races this fall, and I'm quite optimistic about that.
Well, we better be optimistic if we want to control or take over this bill.
Exactly, but I do think, back in 2010, the Tea Party movement, people, everybody got very, up in arms about Obamacare, and the Republicans did well in the elections. I think the 2012, there was just, I think our candidate, Mitt Romney, did not instill a lot of confidence in people, to vote for him, and there wasn't the excitement over let's repeal and replace Obamacare. I think these 2014 and 2016 elections, Obamacare is going to be really going to be the rallying point, and the Republicans, the candidates are going to have to be solid. They're going to have to really push for repeal and replace, in particular in light of the fact that the administration and the president are saying we've enrolled 7.1 million by March 31st. We met our goal, and so let's pop open the champagne.
Yeah, but the majority of those people that are enrolled, Sally, are Medi-Cal. And Medi-Cal people don't pay any premium at all. That's paid by the taxpayer. And the government specifically is going to fund the first 2 years. But after that, it's up to the individual states to fund the Medicare or Medi-Cal people. Now, what's going to happen to the budgets? How are they going to pay for these things?
Well, you bring up a very important point. The administration says 4.5 million, on top of the 7.1 million people, have signed up for Medicaid, the program for low-income Americans. I think it's really revealing that what we've seen in Massachusetts for the Medicaid expansion there under Obamacare, a lot of those people have found that they can't get a doctor, or they have very long waits to get an appointment with a doctor because the reimbursement rates for people on Medicaid, or here in California it's called Medi-Cal, are so low, between 38 and 42% below what they get for treating a regular patient with insurance, that so these people can't, get a doctor, or they have to wait too long. So emergency room use is increasing, which is exactly what the president promised us, that emergency room use would go down, if Obamacare became the law. And then, you're right. Of the Medicaid expansion, in the June 2012 decision of the U.S. Supreme Court, the justices ruled that the federal government could not force the states to expand their Medicaid programs. So what we've seen is 5 states still have not made up their mind about whether they're going to expand, Pennsylvania being one of them. I think we have 26 states have signed on to the Medicaid expansion, and about 19 states have said they're not. For example, Texas, Louisiana, they have not taken the funds. But these funds are only going to last for 2 years, and then what are the states going to do? And most states are in a financial situation.
Sally, we got to take a quick break.
Yep, we'll be back in a moment on Taking Care of Business on Koerner Radio News Talk 1180.